Hi, class. Welcome to week 7, the final week of this course in Theories of Personality. This week is a great opportunity to review all of the different learning and theories and really apply the knowledge to a case study and sort of synthesize and integrate the information, pulling out what was most impactful and paramount for you and what you think you might apply moving forward. So, there is one discussion post due and one assignment due, a final paper. For your discussion post, we are asking for you to really just take a nice moment to reflect on this course as a whole and the learning as a whole, and to highlight what were your key takeaways, what were the real theories or psychological concepts that struck you, that were either new to you or most impactful in helping describe personality and behavior. And please review those. Also, I'd love for you to identify if there were any challenges with the learning in this course, any particular concepts or theories that were more complex or more difficult to digest, or any just aspect about the course and the learning in general, to please explore that. And what did you do to sort of work towards overcoming those challenges? What sort of helped you improve upon when there was some difficulty? And then I hope you can share a little bit about what you'll take with you moving forward. What aspects of the learning do you see yourself applying, either personally, professionally, or academically? And provide some examples too with that, if you can, and how that might show up or be utilized moving forward. So, really, a reflection about everything all together in the discussion post. And then, again, as I started to talk about a little bit last week, you have your final paper that's due this week, which is really reviewing a case study in depth, an example that we've already provided for you that we'd like for you to apply theory to. And then take 5 different theories throughout this entire course, one theory from each different kind of theoretical orientation or branch of theory. So not 2 trait theories or 2 behavior theories, right? We're going to try to diversify the application of theory to this case. And so take one psychodynamic, for example, and take one trait or behavioral biological theory, for example. So from all the different paradigms, and you're going to take some time to describe the case examples, mental health challenges through the lens of that theory. How would the theory describe the root of the issues, the how and why it's manifesting the way it is, why those challenges are there through the lens of that theory, and in describing some of the concepts of the theory? Um, I'd like for you to also think about sort of how and why the functioning may be continuing based on that theory, and then segue really into what would help get this person unstuck and make improvements and move forward. What are real specific therapeutic modalities or interventions from that theory, from that lens of treatment, that theory? Would there be specific treatment that would help this patient? What would be most helpful from that theory? This is a really nice way to look at all the varied options available in ways of conceptualizing the case study and in approaching treatment. So there are many options in our clinical work. And many times, I think sometimes the more seasoned and experienced providers tend to integrate a few different approaches and modalities to treatment. Everyone has their own cultural, spiritual, ethnic kind of background. If we're a cookie cutter about our approaches to treatment, it can be quite limited. Everyone learns differently, thinks differently, and approaches relationships differently. And so it's really fruitful to be able to start to think about how can you round out your own training or learning if you're going to be, especially going into a clinical type of role. I appreciate many of you really applying your own personal and clinical experiences to the work thus far. I've enjoyed getting to know you throughout this brief course. And just a couple last minute reminders as well. Please integrate research in citations following APA formatting. And please be on time with your work this week, the final week of this course, week 7. I cannot accept work late for week 7 work for credit. because grades are due as a whole, and I need to clean everything up and make sure everything's accurate. So it is important that work's on time, and it is one of APATH's like guidelines or rules. And if there are any questions again or concerns about the learning, please let me know. I've been doing this a while, and also if folks would like to consult about anything at all professionally, to just let me know. I'm always happy to be available in that way to students as well. I wish you the best. Take care and happy final week of this course. You're almost there. Take care. Bye bye.